What questions do you have for a primary care physician?
Well, Dr. Jade, I'm hot.
Okay.
I just turned 40. Some things are changing. What do I do?
Yeah, hormonal changes are so common, and there can be so many different reasons for that, right? Hot flashes are a common concern and symptom for women in different stages of life, but 40 is a common time and season. And so I always tell people, get established with a wellness-focused physician who is trained on hormone management that can actually look into this with you, both from the medical screening side of things, making sure things like your thyroid are functioning normally, making sure your weight isn't a reason that this is happening, making sure that your estrogen and progesterone levels and the natural progression of our hormones decreasing is not a part of this, and then having those full-fledged discussions on both the wellness aspect of things, like decreasing spicy foods, making sure you have a healthy weight, exercising regularly. These actually can decrease hot flashes. And then also knowing estrogen producing foods like tofu have lots of estrogen. So having those type of wellness discussions, but then screening medically. And then if you're a good fit for hormone replacement therapy, that's another discussion, and the pros and cons of that can be had with a physician that knows you. So I tell people, get established with a physician that provides quality, wellness-focused care and is trained in hormone management that can really have that full discussion with you. And of course, if you're in Las Vegas, we'd love to care for you at Inspire Primary Care, because we have a hormone replacement plan and we are certified in hormone management. And that's a big part of what we do with the wellness focus. That was a great question.